Can everybody see my screen? Est-ce que tout le monde va voir mon écran?
Not yet. Okay, all right.
Okay, perfect. Is it okay if I speak in English or would you prefer in French? Oui.
Please, Deborah, we are not seeing the screen.
You cannot see the screen?
Okay, perfect.
Okay, so I will share my screen again and I will start. Wonderful. Well, nice to see everybody. Thank you very much for the kind invitation. Thank you so much for the great organizers today. It is a pleasure to be joining you in Benin. I am calling in from Washington, D.C. in the United States, and I'm very pleased to be here. And today we will be discussing public education, particularly with antimicrobial resistance and One Health. And for simplicity, health to une santé instead of une seule santé, because it seems like in different areas of the world, people call One Health different things. So for today, I will be listing it as une santé. Okay. Today, we will be speaking about 4 different steps. The first step that we will be talking about is really, what does public education look like when it comes to health? How can you explain health to the general public, especially the general public who do not have a science background? And we are going to be using 2 different topics, One Health as the first, and antimicrobial resistance as the second. After that, we will be exploring why it is important to teach students in primary and secondary schools about both antimicrobial resistance and One Health. Next, we will explore ways to join a global movement in the education of One Health. And lastly, we will be discussing ways to really explain with communities, your local community, but also communities around the world, about antimicrobial resistance. First, we will be talking about really what does public education look like when we discuss health. My background is I am a veterinarian. I am also and have been working in policy and worked with One Health policy. And now I am leading an organization that brings high quality education focused on One Health around the world. And that organization is called One Health Lessons. You can feel free to explore the YouTube channel of One Health Lessons to learn more, and also explore onehealthlessons.com. First, let's dive into how can you explain something as complicated as One Health to people without any science background. For instance, when you explain One Health to children who are 6 years old or 7 years old, how can you explain that? Well, it really comes down to making sure that your communication is as clear as possible and as simple as possible. So I explain One Health in santé in 2 different ways. I say it is a concept and I say it is an approach. On this slide right here, it kind of combines the 2 and I will explain it. So the One Health concept is that connection between our health and the health of the environment, animals, and plants. Now, the One Health approach is teamwork. It's collaboration between people of various strengths, of people of various disciplines, And we all work together to ensure that the health of the planet, animals, people, plants, and the general environment stay healthy. So the way you can explain the One Health approach in only one word, it is teamwork. And this is a very easy way to explain One Health to children. Now, with onehealthlessons.com, you can go there and find 7 different age-appropriate lessons about COVID-19. Those lessons are being translated into 81 different languages today. 81 different languages today. And certainly French is one of those languages. We are going to be exploring a little bit more of how we can convey something so complicated like One Health and also antimicrobial resistance to children and the general public. Now, I don't know if many of you have children or have had the experience of teaching children, but the goal is to have the children and the students in general laugh and play and have fun at the same time as learning new material. I wanted to bring to your attention eBug. eBug is this wonderful website that's out of Public Health England. And eBug is dedicated to educating school children about antimicrobial resistance. And it's available in a lot of different languages, including French. And the material online is freely accessible. And I encourage you all to spread the news about eBug. So the way to find that is e-bug, B-U-G, .eu. And you can see that there are a lot of different games online that teach the students how to clean your hands, how germs can spread, and the like. Because ultimately, and I will be discussing this a little bit later on, but we have to think about what are the preventative measures to combat antimicrobial resistance, and then also what are the alternatives. Going on, why is educating, why is teaching primary and secondary school children important? Now, we have seen that children are very powerful because children have the opportunity to tell their parents about what they learned. They can also not only tell their parents, they can tell their friends in other households. When you start to include the adults coming from the children's perspective, then you educate families, you educate communities, and that's how you can change societies. Another way to explain why it is important to teach children in primary and secondary schools, it's sensitizing the community. And to demonstrate that, I wanted to bring you from the perspective, from the point of view of really the next generation. I know today we are talking mainly about the next generation being university students. And it's true, they are a part of it. But what about the sustainability of our efforts? We have to try to leverage as many people as possible who are passionate about combating antimicrobial resistance and people who are passionate about working with people from other disciplines and taking the One Health approach and bringing that passion and that knowledge to inspire children, because that's how we can start to change the world and have it be sustainable. Children want to learn. They're excited to learn. I have had the pleasure to teach students around the world, and they all have something in common. Can you guess what that is? All the students are curious. They're all curious. So what is the impact really of teaching about One Health, or even taking it a step further about antimicrobial resistance? I will be sharing a story with you right now. And this is a true story. In the COVID-19 lesson, we talk about something called antigenic shift. It's a type of mutation. It's a type of mutation where one virus can combine with another virus inside of something like a pig and create a whole new virus. And this happens in swine flu, in grippe porcine, I think it's called in French. And this happens in real life. But how do I explain this to children so that they can understand it? Well, I get them to play a game. And this game combines a red sentence and a blue sentence, and we combine those sentences to make a mutated sentence that looks purple. And this is the feedback. This is the review that I got from a student. And I will try my best to translate this into French. OK, chers scientists, j'ai appris que quand il y a deux virus qui entrent une seule corps d'un animal, c'est possible à créer une autre. Ça, c'était mon section février. Quand j'ai dit à mes parents, ils étaient surpris. Aussi, le deuxième, section février après ça, était pendant était pendant l'activité quand on peut combiner deux différentes sortes de phrases ensemble et enfin il y a une autre phrase. J'espère qu'on va te revoir. Okay. And so can you imagine, and I'm sorry about my accent, I know it is terrible, but can you guess how old Riley is? He is only 9 years old. And the important part of this slide is that Riley not only learned something, he remembered it, and then he told his family. And I get these messages from around the world. Children are curious. Children want to learn, and they remember. And when they become passionate about something, they share their stories. And that's how you can change societies. This is an example of teaching in person, because the lessons at onehealthlessons.com, they can be taught online, but they can also be taught in person. And this gentleman here was teaching about One Health to about 50 different students at once. And can you imagine the potential of these students going home and telling their parents? If he's talking about antimicrobial resistance, can you imagine the impact on that community? Look how interested this young man is. What's the potential there? Do you see it? And when it comes to One Health, the way I explain it is, right, One Health is collaboration, it's teamwork. And what can we do with that teamwork? Well, we can solve a lot of problems with teamwork. As you can imagine, these are the United Nations Sustainable Development Goals, which I'm sure you all know. And look at number 17, partnerships for the goals. Partnerships is the same thing as teamwork. It's the same thing as One Health. Now, I particularly am interested in reduce inequalities. And that is one of the reasons why I really, really wanted the learning material at onehealthlessons.com to become accessible to people around the world, regardless of their various abilities, regardless of their location on the planet, regardless of their access to internet. So when I put the call out 2 weeks after I announced online that onehealthlessons.com was launched. Just 2 weeks later, in May of 2020, since then, 81 different languages are in process of being of these lessons being translated. So it's that decreased inequalities, have equal access to both men and women, females and males, and together, using all of our different strengths and combining them, we can solve a lot of problems. Going on, why and how actually, what are the ways to get involved in this One Health education movement? Well, we have a Train the Trainer program, and I wanted to discuss that with you. And think about the opportunity to use this platform and bring antimicrobial resistance education into as many languages as the One Health lessons. And think about what we can do together to partner and to create changes in our communities around the world. So this Train the Trainer program, it's called Certified Lesson Leaders Program, and it comes in a few steps. The first step is to really orient yourself. How do you speak with a 6-year-old? How do you speak with a 14-year-old? Those are very different audiences, as you can imagine. The second step, and this is all training online. The second step is to observe a lesson being taught by me to students, and then after that, to finish a quiz, to pass a quiz. The third step is to observe a live lesson being taught. Right now, One Health Lessons has partnered with an organization in California in the United States, and these lessons are being taught in English. But in the future, and I will tell you in a few steps how we can bring this home. So step number 3 is to observe a live lesson. And step number 4 is to teach the live lesson, and this will be all virtual. Now here's step number 5. We have to bring these lessons home. It is not enough to just teach these lessons in English. We want to teach these lessons in languages that are spoken in the house, in everybody's communities. And you can see that French is one of the first languages where these lessons have been translated into, fortunately. And step number 6, and this is the goal of all of it. The mission of One Health Lessons is to inspire every student on the planet to value One Health, to value that connection, to value how our health is dependent on the health of animals, plants, and the environment. And antimicrobial resistance definitely plays into that. So step number 6, the final step, is to teach people in your own communities, in your own first language, how to teach these lessons. And if you get to step number 6, then you become a One Health Lessons ambassador. There have been opportunities around the world of sharing this message about One Health and also about the importance of antimicrobial resistance. It can take form in a lot of different ways. It can be community outreach programs focus on particularly the environment and particularly education. Okay, and you can see in this particular picture that was taken in Uganda, there was musical entertainment in celebration of this newfound knowledge for the community, and they also planted a tree at the end of the event. Then this photo, this has to do with mainly animal husbandry and animal health. But what's important is that we tie in animal health to human health. And it would be very easy to have a conversation about antimicrobial resistance in these platforms. So really the education movement that's happening today with One Health, it's meant to protect future health. And now we're going to be specifically diving into how to speak about antimicrobial resistance in your community. When I say your community, I mean our community, because ultimately actions in one area of the world will affect health in another area. We're all on one planet. We all are dealing with how we are influencing the environment, and then the ramifications of that, the consequences of how we treat the environment. So this is something that I have learned on the Hill. And when I mean the Hill, I mean when I was working in the federal government in the United States as a science policy advisor, I learned several different techniques that I'm now bringing home. And I'm also writing them in a book that I have, that I'm almost ready to publish. The first thing to remember, and I'm not going to be going into in this presentation because I'm sure you all know about, say, for instance, antimicrobial resistance coming from food animals and having that contaminate in the water, and then also how that can affect fruit and vegetables. You're all experts in this, so I'm not going to go into that section. But the thing that is very important, is to remember that it is not enough to just talk about the problems. Okay, let me say that again. It is not enough to talk about the problems. What people want to know are the solutions and what are the alternatives. That's what the focus should be on. I think that it is very important to just give a very brief background of why antimicrobial resistance is a big problem for people around the world. We all know the statistic, right? We all know the statistic. If nothing changes by 2050, more people will die of antimicrobial resistance compared to cancer today. We all know that. And that's scary, right? That's really scary to hear. But when you're talking with people who can change policy, when you're talking with people who can change, who are really powerful networkers and communicators and influencers, the key that you really want to drive home, the message you really want to emphasize are what are the solutions? How can we prevent this from getting worse? And what are the alternatives? And so really, when it comes to education, it comes down to having people feel like they are in control of decreasing their risk. But the only way they can control decreasing their risk is knowing how to do that. And it's through education, right? So the very first step when you're trying to change the minds of your audience is first identify your audience. And this brings me to two special questions, really. Who are the ones in the household who are taking care of the animals? Who are they? And then also, who is the person, or who are the people going to the pharmacy and asking for antibiotics? So as long as you can answer those two questions, then you're well on your way. So is it the grandmother? Is it the father who's taking care of these animals? Is it the children who are taking care of these animals? Is it the mother? Or is it only the child? And then say, for instance, if it's only the child, or say children taking care of the animals, is it the mother or the father or grandmother who's having them go out and grab the antibiotics from the store? So those are the two important parts that are really essential to help solve the problem with communicating about antimicrobial resistance. The second step is really understand the needs of your target audience. Now, when it comes to the target audience, think to yourself, why do they want the antibiotics? What is the underlying cause? Why is there even a need for the antibiotics, right? What's the underlying cause? Is it because of poor animal husbandry, right? Is it because people are not washing their hands properly before eating? Is it because they are drinking raw milk or eating raw meat? Is it that they are washing the fruits and vegetables with contaminated water? So what is the underlying cause? Why do they need those antibiotics? And then also, are they giving antibiotics to their animals or to their children or to themselves because they think that antibiotics solve all problems, right? Is really identifying that cause. Now, keep in mind, when you are speaking, especially to children, but honestly, when I am listening to a webinar or trying to learn something, I always like to be engaged. And the more engagement, the more likely you will have your audience remember your presentation, and more importantly, remember the meaning behind your presentation. So really, what is the impact of teaching the future generation, next generation, about One Health? And this is particularly taken from the COVID-19 lesson. You can see here that all of these methods really can be used in the same way as talking about preventing, or say diminishing, decreasing the risk of antibiotic resistance or antimicrobial resistance, because we're taking care of the environment. We're trying to prevent further spread of infectious disease. And so one method to reduce the risk of antimicrobial resistance is having good hygiene and teaching the children about how to clean their hands properly, or teaching the people who are taking care of the food how to wash their hands properly immediately before, eating, or before cooking, or whatever the process is for that particular meal. And here is another very important section. And I know that we were talking earlier about vaccines and COVID-19, and I thought that that was a very well done presentation, very important message. And how can we teach the communities about vaccines? Well, again, we have to have them interact in these lessons. We have to have them have fun. They need to play, they need to laugh. And when they do that, then they remember the message a lot more. This is the way I explain what vaccines are to people who do not have a strong science background, but who do understand just the idea of the immune system, right? So I say it's a substance because that's the easiest word to explain. That prepares the immune system to fight a sickness. And when it comes to teaching students about this, I make sure that the students understand that a vaccine comes to the patient before somebody gets sick, and a medication is given after somebody gets sick. The entire purpose of a vaccine is to make sure that your body is as strong as possible. And another nice way to talk about vaccines in the classroom, because I am a veterinarian, right? I am an animal doctor. When I come across a classroom full of students and some of their students were taught that vaccines are scary because their parents are scared of this, well, then what I say is I give vaccines to my animal patients because I want to make sure they stay protected. And I change the focus from vaccinating people to something less direct, and say vaccinating animals. Because ultimately, a lot of children care about animals. The goal of this conversation is really to have the students understand what a vaccine is meant for, and understand that vaccines are meant to protect people and animals to fight future diseases. And so I wanted to leave you with a few other ideas for combating antimicrobial resistance. Certainly educating the policymakers, right? Educating the political world about modifying about access to these antibiotics? Do we want to try to limit the antibiotic access to the general public? And if so, why? And if so, what are the other options? Next is make sure that whenever you're speaking about antimicrobial resistance, if you're creating, say, lessons about this, make sure it's appropriate for the age. It is very difficult to use a high school, or excuse me, a secondary school lesson for 6-year-olds because they will not understand it. So you always have to understand your target audience. Number 3, really, can you get information in the background of, say, very popular television shows or radio shows? And of course, radio can reach further than compared to television, but also think about the community that have visual impairments, who are blind, for instance, who cannot see very well. Well, they're relying on the radio quite a bit. And the radio is often played just in the background. So can you imagine having the message about antimicrobial resistance playing on the radio in popular shows? And then lastly, think about public-private partnerships. Think about how the government can associate with either non-government organizations or other local nonprofits and work together in order to really create some type of community awareness program. I wanted to thank you all very much for your time, for your attention, and I'm happy to answer questions. And if there's, for some reason, confusion in language, then I would appreciate somebody to just translate it for me. Thank you.
Okay, thank you, Dr. Deborah, for your well-done presentation. We can move now to the session room or those who are on the line who have questions or any comments. Vous avez des questions dans la salle? Questions?
Oui, c'est une question.
On a une question.
J'ai une question.
I see Dr. Bade.
Allô?
Ceux qui sont en ligne, attendez, on a une question dans la salle.
Oui, j'ai une question. I have a
I see that there is one question by Dr. Bade. You're muted.
Okay. Thank you, Dr. Thomson.
Okay. Can you hear me?
Yes.
Okay. Thanks, Dr. Deborah, for her brand presentation.
Il faut lui dire que ce n'est pas son tour.
Please, who is talking on the line?
Dr. Bade.
Dr. Balde.
Hello. Can I speak? So as I was,
I can hear you.
yeah. So as I was speaking, you know, in Africa community, most of them are illiterate. So imagine, normally you are talking about the teamwork, you understand? So children go to school, teachers are explaining to them the importance of antibiotic, antimicrobial resistance. Then they come home, and the parents are not capable of explaining this. How could you let this message pass? That's my first question.
That is such a good question. Thank you so much for asking.
Yeah. So my last question is this. No, you know, you are telling people with limited resources, because we are in Africa. You are telling people with limited resources, don't drink this water because this water is contaminated. You understand? So which are the alternatives that you give those people so that they shouldn't drink those water? Because if they don't have the means to drink proper water, so how are they going to protect themselves? I think you understand what I mean. So
Absolutely.
that's all. Okay, that's all. Thanks.
Thank you so much. Really,
Anyone on the line?
and you know, can you hear me?
Dr.
Yeah, I
Deborah,
can hear you. I can hear you.
you have to correct the question before.
Now, you know, a large portion is illiterate. Well, that is really important to remember. It's the power of visuals, right? It's the power of visuals, and it's the power of storytelling, and making sure that, you know, the message does not necessarily have to be written. It does not have to be shown. It could be demonstrated in a play, for instance. It could be demonstrated in a picture book if they like that. How should I say that? I would say, and this is the message for everybody around the world, that our limitation, the only thing that's limiting us is our creativity. So if we can try to get around barriers every single society, right? In every single barriers between, you know, in my community versus your community, but there are still barriers. And so, okay, hopefully everybody can hear me. But the take home message is that the first thing we need to do is identify how we can overcome these barriers in a creative manner that respects our audience and also try to protect our audience as much as possible. And that brings me to the second point that you made. And it is so important to remember that, because, and it happens where I am too, particularly after natural disasters and things like that. You know, you can't tell people, you know, stop drinking the water if you're thirsty and there are no other options, right? But what we need to do as a community, and when I say community, I mean, you know, everybody involved, is to try to explore ways to make that water safer. How can we, are there alternatives than drinking? Do we have to boil that water first, right? Do we have to avoid this well for a certain amount of time? How can we make sure that people are not sharing the same water source as their animals? And I guess with that, how can you, and if you have to, then what's the next step to make sure that people stay healthy, right? If you have to share with animals, then you could take it and then boil it or do whatever, you know, in the world, there are so many different types of parasites and pathogens and water, and the treatment is all different. So I'm just trying to say collectively, we have to first identify the problem in that particular community, find that alternative, and then make sure that we explain the alternative in a way that makes sense to the public and in a way that's very simple to remember. Does that make sense? I hope I explained it well. You asked very good questions. Thank you so much for that.
Okay, thank you, Dr. Thomson. I'm Regis from Benin. I would like to thank you first for your presentation. I really appreciate the concept, One Health lessons. And what I'd like to know is if that concept is like a community, does it have a community of One Health lesson teacher over the world, or it's just a concept that we should apply in any country? That's my question. Thank you.
Thank you very much for that question. I really appreciate that. So the beautiful thing with One Health Lessons is that the website was started in May of 2020, and now we have about 1,000 people involved in One Health Lessons. And they are either translating these lessons into languages around the world. And when I say languages, I don't just mean the official national language. You know, there are so many different languages and so in just a single country. And so we try to get as many indigenous languages as possible, as many tribal languages as possible. And I remember there was somebody in Malaysia reaching out to me and saying that she wanted to create a specific lesson for this indigenous community in Malaysia. So she wanted to translate it into another language. I thought that was wonderful because the whole point is to have these lessons be accessible to people in their own first language, in the language spoken at home. And what was remarked earlier is that, sure, there's a very, very large percentage on this planet of people who are illiterate. I understand that, and there are many people around the world trying to combat that. The beautiful thing with One Health lessons is that one person just needs to be literate and they can read the material and other people will understand it. And also there are a lot of pictures involved. The other part of One Health lessons is that hundreds of people are being trained right now to learn how to teach these lessons in their own communities. And that's what those 6 steps that I presented were focused on. So I know that Dr. Sesu is speaking with One Health lessons quite a bit and determining how we can get more people in Benin involved in One Health lessons activities. I think it would be absolutely incredible if Benin could be, the most, it could be like the poster child is what we say in English. So like the leader, I guess is the best way to say it, is the leader of the French speaking world and say, look, this works so well in French. This makes such a difference in the community. Other places, other countries in Western Africa, in France, in Quebec, in Canada, places all over the world that speak French can follow your lead and have Benin be the first in the world. I think that would be incredible. So happy to connect on LinkedIn, happy to connect on my email, which is onehealthlessons@gmail.com. Thank you so much for that question.
Okay. Madam Bison. Madam Bison.
Thank you very much. Yes, I'm ready. Thank you very much, Deborah, for your interesting presentation. So I am Natalie and I'm based in Sweden. I work for a foundation called International Foundation for Science, and we support young scientists in developing countries. And many of these participants, and especially those in the scientific community, they are our grantees now or former grantees, very bright people. So I'm very proud to be with them and I like this event, yeah? And so I like very much your presentation, especially when you shared that the way of communicating with people, it's very important. And you have to adapt the way you are communicating according to your audience. And then the audience also, you do not need to have just one target, but since it's One Health approach, and actually in all the development goals, we have to work together. And that's what we are. So I like that. And then IFS also is that. But my question is, do you have any feedback at this time or these people working in their communities about this, how it impacts on adults? Because I see, if I put it in the context of Africa, or let's say in Madagascar, because I am originally from Madagascar, I hardly believe that young children would go and teach their senior how it is. These people are very aware that their kids have to go to school, but until they have a degree, they wouldn't believe in them. And it's kind of an insult as well for them if young children. And the contradiction is that it's more efficient that we teach our young children very early in their age to have such a behavior, you see? And so it's very difficult. If I can share with you one experience that I had when I was very young, a long time ago, when I learned about the sexual, that was about how you make children, how it can be, and you shouldn't really make children every year. And this, I have learned that, you see? Then it was very difficult to share that with people who were much older than me. I think when I discovered it first, I was about 14. And then I shared that with my mom, who was very shocked, although she is educated, because I am only 14, but I knew that how they can avoid it. I went to the medical doctor, who is a good friend of mine, and I said, I am not going to sleep if you are not going to share that with others, because I am not allowed to do that. And then they cannot go to schools. So I was very surprised. We did it in church. Can you imagine? And which is really not prohibited by my church. These kind of things are not really procreating, you see? And it works very well. And then so children were there, the medical doctor were there, the parents were there, because we were united by this church, you see? Regardless of your social level, your school, this is kind of authority for everybody, then they would believe in you. So that's why I'm very interested to know, do you have any feedback, how they are reacted? Do you have any positive answer? Response? It would be really great that you share that with us so we learn from that as well. Thank you.
Thank you so much for bringing that up. And I think it is such an important thing. And of course, you touched upon something that I did not necessarily talk much about is cultural differences, right? And cultural sensitivities.
Yeah.
So two things I wanted to bring up in this answer. Number one, when it comes to the people who are translating, the reason why I did not want to get Google Translate involved is because I wanted to have the people who understand the community translate and deliver the message in such a way that will be appreciated and well received by the community.
Yeah.
That was one of my very early goals with getting the translations. Certainly, there are sometimes very sensitive topics that can be brought up in One Health, and particularly when we talk about diseases that jump between different species, zoonotic diseases. And if we talk about, say, wildlife trafficking, or if we talk about things like wildlife markets or animal markets, eating wild animals, I want to make sure that the message is delivered in an objective way and has no cultural how should I say this? No perception of diminishing cultural needs or anything like that. It's more like there are risks involved with this, that, and the other. Here are the other options that you can take, and just leave it like that. So people can interpret it that way. So I wanted to mention the cultural sensitivities that are built into the translations. Now, when you talk about the measurements and the feedback that I'm getting from around the world. So one of the reasons why I wanted to create the Lesson Leaders program, and that funnels into the One Health Lessons Ambassadors program, is because ultimately the people who are coming to become proficient lesson leaders, they are adults. They are at least 18 years old, and they go into schools in their own communities as science guests. And so these science guests teach the students. And then, at that point, sure, you're educating the students, and that might work just fine on that level in that society, right? In that community, in that culture. But it still means that there's an adult in the room who has this information, who has this knowledge. And then that adult can then speak with other community leaders, and then they can also teach other adults how to teach these lessons, and that's how it spreads. So it's depending on the culture, of course. Sometimes, like in this culture in the United States, well, honestly, there are so many subcultures in the United States that sometimes it works, sometimes it doesn't work. But sometimes the students teach their parents or have conversations with their parents. But other times it's the teachers at the schools that are typically with the students, the full-time teachers, they're learning at the same time as their students from the science guest.
Okay.
So if the full-time teachers in the schools are learning about One Health and learning about that connection, well, they're valued a different way in the community, right? So I hope that explains the
Yeah.
yeah.
Yeah, of course, yeah. You take into account this culture difference, yeah?
Absolutely.
Thank
Absolutely.
you.
Thank you so much.
Yeah.
Okay. Do we have anyone on the line who want to make any comment or ask questions? Okay, Deborah, you hear me? I have one question for you.
I can hear a little. I'm sorry.
Okay. I would like to be practice. So when starting working with people with schools, first I would like to know, are you working with private school or public school? And both of them? That's the first question. But
both of them.
Both of them, okay. So I would like to know, how did you manage to have the authorities in charge of education? How did you manage to have the go ahead of your approach to teach those kids?
Right. Okay. So,
and I would like also to know,
right,
if with the countries in which you are working in Africa, I don't know if you have any success stories to share with us that can let many people to open their mind on this approach. Thank you.
okay, thank you very much. Okay, so just like when I was responding to Dr. Pearson's comment or question, you know, every country is different, right? Every educational system is different, every culture is different. And so what we do typically to start at, at the very start is to work with extracurricular activities. So meaning if we could be a science guest in a classroom for 1 hour, that would be amazing. Sometimes I know, say for instance, in France, for France, it is incredibly difficult to get into classrooms unless the Ministry of Education is involved, right? And that sometimes happens in a lot of other countries. So the technique that we use, and this happened in Uganda, actually the picture that I showed earlier with the musical instrument in the background and somebody with a microphone. So that was a community event in Kampala in Uganda, and it taught the elders in the community about the importance of water, cleanliness, quantity, quality, and at the same time, how all of this played into our health, animal health. And so we, One Health Lessons, had a partnership with, and still do have a partnership with, a nonprofit organization in Uganda. And so they wanted to have our learning material brought to the attention of the community members and the community leaders. They not only had the local community leaders, but they also invited people from the Ministry of Education, the Ministry of Health, Ministry of Water Quality. And so from there, that opened the door to have conversations with how we can bring these lessons into schools. But it started with community events, which was really wonderful. And right now that organization is planning another event in Western Uganda. And you asked earlier about where there have been people involved with One Health Lessons and where they are in Africa. Oh my goodness. Okay, so I'll just read off the list that I can remember. Okay, so, and I'll just be jumping around the continent.
I think we have to do more. And thank you for your collaboration.